So hello friends, so today we are going to discuss about the exterior of the skull. I will be referring to BDC's 8th edition, and which is the head and neck part, so that you don't have any problem while referring it to your notes, or if you are reading it BDC, it will be very much convenient to study about it. So today we are going to discuss about NORMA Verticalis, which comes under the heading of exterior of skull, right? So what's the shape? When viewed from above, the skull is usually oval in shape. It is wider posteriorly, so it's wider posteriorly than anteriorly. So this is the anterior of skull and this is the posterior portion of skull. I hope you can see it. This is the anterior, this is the posterior. Now the shape may be nearly circular, but it's not circular. You can see it's a bit oval in shape. It's a bit oval. So let's talk about the major bones constituting the NORMA verticalis. So anteriorly we have this frontal bone. So this is the upper part of frontal bone anteriorly. Now the uppermost part of occipital bone, you can see it clearly over here. See, I am indicating it. So this is the uppermost part of the occipital bone posteriorly. Then we have the parietal bone on each side. So these two are the parietal bones. Okay, so let's talk about the sutures now. So this one right here is the coronal suture. You can see it. This is the coronal suture. This is placed between the frontal and the two parietal bones. The suture crosses the cranial vault. So this is the cranial vault actually. Those who don't know about the cranial vault is the space, which is enclosed by the cranium. So that is the cranial vault. The suture crosses the cranial vault from side to side. See, from right side to the left side. So and runs downwards and forwards. So how is it running? Downwards and forwards. See, it's downwards and forwards. It's going forward and downward. So that was about it. So this was the coronal suture. Now coming towards the sagittal suture, it is placed. So this is the sagittal suture. It is placed in the median plane between the two parietal bones. So these are the two parietal bones, the topmost part of the parietal bones, and this is the median plane between the two parietal bones. So this one is the sagittal suture. Now coming towards the lambda suture, it lies posteriorly between the occipital and the two parietal bones. So this is the occipital bone over here posteriorly. So I am showing you the posterior view actually. So this is the occipital bone and these two are the parietal bones. So what is the lambda suture? So and it runs downwards and forwards across the cranial vault. So see, this is the lambda suture and it runs downwards and forwards. So if I see the NORMA lateralis, the side view of it, and see, so this is the lambda suture. It's running downward and forward across the cranial vault on each side. Now let's come to the metopic suture. This is occasionally present in 3 to 8% of individuals. It lies in the median plane and separates the two halves of the frontal bone. So it's generally over here, the metopic suture. So it's generally here, but it's not present actually. It's present in 3 to 8% of individuals. It lies in the median plane and separates the two halves of the frontal bone. So here it's not present. So I told you that it's present only in 3 to 8% of the individuals. Normally it fuses at the age of 6 years. So generally you don't see it. The metopic suture is very rare. If you could see it somewhere, so it generally runs medially between the frontal bones, separating it into two halves, and it generally fuses at the age of 6 years. So this were about the sutures. Now let us talk about some other features of NORMA verticalis. So I already showed you the sagittal suture. So this one is the sagittal suture, you can see. So vertex is the highest point. I name it again. Vertex is the highest point on the sagittal suture. It's generally present in the midpoint somewhere over here. So it's like the highest point of the sagittal suture. So if a question comes that what's the highest point of the sagittal suture, you should name it as vertex. Now, what is actually the vault of the skull? The vault of the skull is the arched roof for the dome of the skull. See, the skull, the vertical part, the vertical portion of the skull is actually forming a dome kind of shape. It's like a dome kind of thing. So this is called the vault of the skull. Okay. Now we come to a most important part. So I told you this one is the coronal suture and this one is the sagittal suture. Now the meeting point of the coronal suture with the sagittal suture, particularly at this point, you can see this point. This point is called the bregma. So this point is called the bregma. So bregma is the point of, the meeting point of the coronal suture with the sagittal suture. So in the fetal skull, the bregma, this is the site of the membranous gap. So in fetal skull, this is the site of a membranous gap called the anterior fontanelle. Now, you all may be confused what's a fontanelle. A fontanelle is actually a membranous area which is the site of tissue growth. Okay, so it's site of a growth. It's actually a tissue like covering. So it's actually the site of growth in the fetal skull. It permits the growth of the brain because in the fetal stage the brain is still at a developing stage. Okay, so it's expanding in volume. So simultaneously the skull also needs to get adjusted with the space which is getting enlarged inside this vault, of the brain. So the fontanelles are the sites of growth of the skull. Okay, so there are many fontanelles, I will come across it. So for the time being, you remember that in the fetal stage, at the point of bregma, there is actually the anterior fontanelle. Okay, so this actually closes at a time period of 18 to 24 months of age. Okay, so 18 to 24 months of age of post-fetal development, it actually closes. Okay, and what I tell you, what's the function? It actually helps in the growth of the brain. All right. So that was about it. Now coming to the posterior portion, right? This one. So posterior portion. So this one was the sagittal suture, and this one is the lambda suture. Now the point of contact of the sagittal suture with this lambda suture is called the lambda. So this point over here, the point of the meeting point between the sagittal suture and the lambda suture is called the lambda. Okay, so it also helps in the posterior growth of the brain. Okay, posterior growth of the brain. So in the fetal skull, this is the site of, similarly, just like this one, it was the anterior fontanelle at the point of bregma, and this one will be the posterior fontanelle at the point of lambda. So this in the fetal stage, this was the anterior fontanelle at the point of bregma, and at the point of lambda, this is the posterior fontanelle. Okay, now when it closes at birth, which closes at birth, so it closes at 2 to 3 months of age. Okay, sorry to say, I would like to mention, I told here post-fetal development. No, it's not post-fetal development. It will be before birth. Okay, during the birth stage. It means it will not be post-fetal development. Yeah, it will be right to say it, but in a way, just remember it closes at birth. Okay, don't need to say about post-fetal development and all stuff. So this closes at 18 to 24 months of age, and this will close at 2 to 3 months of age. Alright. Next, let's come to the parietal bone. So this one is the parietal bone. It's a flat bone actually. It consists of a pair. So this is the right parietal bone. This is the left parietal bone. Okay. Now when you see the parietal bone, see if you can see it, see, so you can see this area is wider. I mean, this is the area of maximum convexity of the parietal bone. See this portion, actually I'm talking about this portion. If I measure the diameter of it, it will be maximum over this area. Okay, and this two bony prominence, you can see there are two bony prominences. See, if it's clear like this way, see these are the two bony prominences. So this is called the parietal tuber, and is the area of maximum convexity of the parietal bone. This is a common site of fracture of skull. So remember, so this is a common site of fracture of skull. Now coming toward the parietal foramen. So if you can see here, this point over here, see it's actually foramen. Okay, now what are the foramen in skull? Foramens are, I mean, they are like small pits and holes. Oh, it just broke down. It's actually, these are small pits and holes from which there is passage of important vessels, then nerves, veins, and a lot of stuffs inside and outside of the brain. So it forms actually a link. So from here actually many stuff gets passed down inside of the skull. So okay, so there are one on each side. I mean, one in the left, one in the right, and one in the left. So I don't know why it's not here. Maybe it has fused. Okay, so that doesn't make any difference. So this one is the left parietal foramen. Okay, and it's not seen here. I mean, it has fused. It was there actually. So that is the parietal foramen. Okay, pierces the parietal bone. Yes. So what's the distance between lambda and the parietal foramen? It's actually 2.5 to 4 centimeter. Okay, it's actually present 2.5 to 4 centimeter above the lambda. Okay, in front of the lambda. Now what does it, I mean, what does it transmit? The parietal foramen. The parietal foramen transmits an emissary vein from the veins of the scalp. Okay, so you know what I will tell you what's a scalp in the later video. Okay, so it transmits an emissary vein from the veins of the scalp to superior sagittal sinus. Now superior sagittal sinus, it's actually present just below this sagittal suture. Okay, superior sagittal sinus is present just below the sagittal suture. Okay, so coming back to our point, I was talking about the parietal foramen. Actually there was a slight disturbance in the setup, so please avoid it. I mean, please don't mind about it. So what was I telling? So yeah, this was the parietal foramen. So from here it transmits the emissary veins. Okay, emissary veins which connect, I mean, from the veins of the scalp, the emissary veins from the veins of scalp to the superior sagittal sinus. And where is the location of superior sagittal sinus? It is present beneath the superior sagittal suture. Okay, now coming to the obelion. Okay, so I told you the parietal foramen is present on the either side. I mean, one on each side of this sagittal suture, one in the right parietal bone and one in the left parietal bone. And obelion, suppose the other parietal foramen was over here. Okay, so the obelion is actually present between these two parietal foramen. Okay, over here. So this is the point of obelion. Okay, so now let's come to the, so I already told you about the anterior fontanelle and the posterior fontanelle. Okay, and I told you its functions. It's actually helping in the growth of the brain. Okay, so the fontanelles are actually very important sites of brain growth. Okay, because I will tell you afterwards what's actually the function of fontanelle in detail, and if it's not properly, I mean properly functioning, okay, or if it fuses early, it generally retards the brain growth. Okay, somewhat. So we'll tell about it later. Now let's come to the temporal lines. Okay, so let's come over the talk about the temporal lines. Now, the temporal lines begins at the zygomatic process of the frontal bone. So this is the frontal bone and this is the zygomatic process of the frontal bone. Okay, this is zygomatic bone and this is actually the meeting point of the zygomatic bone with the zygomatic process of the frontal bone. Okay, so the temporal lines begin at the zygomatic process of the frontal bone. See, you can see this temporal lines, it's actually coming. Okay, if you can appreciate this temporal lines coming from it. Alright, so it arches backward. Okay, it arches backward and upward. See, the temporal lines are coming arches backward and upward, and cross the frontal bone. It crosses the frontal bone, the coronal suture and the parietal bone. See, this one was the coronal suture. So this temporal line is crossing the coronal suture as well as the parietal bone. Okay, over the parietal bone there are two lines, superior and inferior. Okay, so this one you can see, this line is just bifurcating over this parietal bone and it's making one superior line and one inferior line. Okay, one superior line which is present upwards and one inferior line which is present below of it. Alright, so over the parietal bone there are two lines, superior and inferior. I told you, traced anteriorly they fuse to form a single line. Now if I trace it anteriorly, okay, if I trace it anteriorly, both the superior and inferior lines, okay, both this superior and inferior lines, so it forms a single line over here. See, it forms a single line. Now if I trace it posteriorly, the superior line, see it's getting faded out. If you can appreciate this, see, the superior line is getting faded. It's not prominent over here. It was prominent over here, I mean in this side. See, I can easily make out that this was the superior and this is the inferior line. Okay, but as I go posteriorly, it just fades out. Okay, the superior line fades out over the posterior part of parietal bone. The inferior temporal line, but this inferior temporal line continues downwards and forwards. See, this inferior temporal line is continuing downwards and forwards with the zygomatic arc. Now it's coming to the zygomatic arc. Okay, so this is the zygomatic arc and it's joining it. See, this is the superior temporal line, this is the inferior temporal line, joining the zygomatic arc. If you can make it out, like actually, so if you can see it, it will be worthful if you study it with the skull itself. Alright, because anatomy, I mean when you study osteology, the bone set becomes very much important of it. So it will be very easy if you can arrange a bone set. Okay, or you can just make it out through my video as well. Now let's talk about some clinical anatomy. Okay, so I already told you, if fontanelles fuse early, I mean this fontanelles fuse early, the brain growth is stunted. Okay, the brain growth is stunted. Now what happens is, now if the brain growth is retarded or stunted, the children develop a less intelligence quotient. Okay, I mean I will not say that they are less intelligent, but their IQ level drops due to this this lack of development of the brain. Okay, now this was one point. Now coming towards the anterior fontanelle, if the anterior fontanelle is bulging, okay, means it's like bulging, it's swollen kind of thing, there is a raised intracranial pressure. See, I say it again, if anterior fontanelle is bulging, there is raised intracranial pressure. Okay, there is an increase in the intracranial pressure. And if anterior fontanelle is depressed, if it's not bulging, if it's depressed, then it shows decreased intracranial pressure. It shows decreased intracranial pressure, mostly due to dehydration. Okay, if you are following BDC, you can easily make out. So these points are already mentioned in BDC. I also study from BDC, the osteology portion. Okay, so it will be useful if you are referring to BDC as well while looking into my lectures, because it will help in easily grasping of the concepts and you can revise it as well. Now Now what happens at these 2 points, I mean at these 2 fontanelles? Now during the delivery of the baby, during the vaginal delivery of the baby, the bones override. Now what's the meaning of override? Override means, see, suppose this the gap between these two hands is the fontanelle. Now during delivery, what happens is they override with each other, means they come like this. See, suppose the skull is wanting to come out from the vaginal opening, so they actually override like this, means so that there is no friction between these two. This fontanelle actually helps in, I mean, just adjusting the bones, I mean the bony plates of the skull, so that the skull can easily come out of the vagina. Okay, so that's the meaning of override. Now the BDC has mentioned one important point about the caput succedaneum. Okay, what is it? Caput succedaneum is a soft tissue swelling on any part of the skull. Okay, it may be a soft tissue swelling on any part of the skull due to rupture of capillaries during delivery. Now if suppose some capillaries are getting ruptured, I mean they are getting damaged during the delivery, so what happens is there is a soft tissue swelling. Skull becomes normal within a few days in postnatal life. Okay, but generally the skull becomes normal in postnatal life, but it will be better if you consult a doctor for the same thing. Alright, so this was all about the norma verticalis. I will see you in the next video where I will be talking about norma occipitalis, I mean this portion, and norma basalis, I mean this portion of the skull. So I hope you enjoy it. If you like my content, please don't forget to like, share, comment and subscribe to my channel. So let's learn BTC with me. Okay, so till then, until next time.